starts with a pilot program now underway, and only ABC 15's Nohelani Graff is taking us inside this facility to see what it's all about. She's live outside the county health department. So, Nohe, why were they chosen specifically for this?
So, Nick, this facility is in the West Valley, and there was one known positive case of coronavirus among about 200 staff and residents. So it was a seemingly clean slate with the potential to become a hotspot. And then testing revealed it already was one.
A dining room transformed into a pop-up clinic. This unnamed West Valley care facility now ground zero for a comprehensive testing program that could be implemented across the state.
We can save thousands of lives if we act fast.
The nonprofit testing and supply organization Protect AZ, tapped by the state to lead a case study here. Within a week of being greenlighted to start, Dr. Tyler Southwell says the facility went from one infected staff member to more than 10 sick patients. 8 in the hospital, 3 of them died.
The infection had been taking root in the facility by the time we were there.
8 nurses and technicians plus volunteers, all outfitted by the county with gloves, gowns, masks, and face shields. Sonora Quest supplying nasal swab tests. Working in teams for 7 hours, they repeat a pattern for about 200 people.
The nurse or the medical person would swab, come out, and degown, deglove, and then go to the next room, sanitize, regown.
Within 24 hours, results from the lab. 23 new cases, and any staff infected showed no symptoms.
That's kind of frightening to see the speed it can spread through a facility like that with.
Dr. Southwell says the most tedious part, paperwork, getting consent forms signed, in some cases tracking down the power of attorney. Then there's phase 2, educating staff on something they've never seen.
They've got great camaraderie, but they do feel like a ship at sea, surrounded by the ocean. They're alone.
Teaching facilities how to separate the infected, create dedicated care teams, and identify how much protective gear they really need. And like any regular doctor's visit, he says there has to be follow-up care until the virus is gone. And that's going to require more manpower in order to make it a viable model for the rest of the county and the state.
We really need an army of people in their own communities, serving their community's needs.
So the final piece is to return to the facility in about 1 to 2 weeks and retest everyone to see if they were successful in stopping the spread. So in the meantime, Protect AZ is hoping that the county and the state will let them continue to test at new facilities. And if you would like to donate time or funds to their cause, you can find them at protectaz.org. Nick, I should also mention the governor did say that they would start this pilot program in northern and southern Arizona. They have not responded to our questions of whether or not that did start yesterday.
Okay, Nohelani Graff keeping them honest for us this morning. Nohe, thank you. Meantime,